I'm Kate Rush and I'm Medical Director at Sirona Care and Health. I'm going to talk to you today about Sirona's response to COVID and how we did that, and also about how we're looking to restore services following the first wave of the pandemic. COVID-19 required a really quick response from a range of organisations across health and social care in our area to make sure that we best protected patients and the people who look after them, as well as our staff members. That could be seen with things like personal protective equipment, including training on its use and making sure that people could still be seen when they needed to be for their healthcare needs without putting them at risk. For example, shielded patients. Other ways of working were developed that still remain, so lots more use of digital and remote consultations to give people the advice and support they need when they need it, and that was for both patients and carers and continues now. There were also other pieces of work that we undertook as a whole system, but also within Sirona around certain clinical areas. So an essential service such as end-of-life care, how would we provide that in a different way or a better way during COVID-19? We released a guidance pack weekly throughout the pandemic phase to all organisations across Bristol, North Somerset and South Gloucestershire, and versions were even included to be sent to residential and care homes so that their staff felt that they could best manage end of life in their setting that was appropriate to them. This included lots of information for carers and patients alike on what to expect and how they could access help and support, as well as some key guidance on prescription medications and so on for healthcare professionals. And that's something we've continued to do now because it's been found to be very beneficial. The other area of work that has been really positively received is around care homes and providing a wraparound support team, which is a team of a whole range of professionals and support staff from a range of areas such as healthcare, community nursing, primary care, social care and third sector, to provide regular contact to care homes so they feel they have a point of call to know where to ask for advice and be able to pick up if they're concerned about a patient to get advice on that quickly. So now the first peak of COVID has settled, work has shifted to look at the restoration of services, so returning services back to what would be considered more normal, but I think the term is new normal because obviously we've developed such innovative ways of linking with people now, such as remote working. How do we combine the two to make sure we still keep people safe while opening up things like referrals and some face-to-face contact? That work's being done as a whole system with a similar approach to restoring services, looking at or making sure that we are not disadvantaging anybody in not restoring a service, how we make sure we have the right estate that can still enable social distancing, that we've got the right workforce on hand, the right PPE, and making sure that people feel confident and comfortable in using services, understanding that this huge amount of thorough work has gone on to make sure that people can access services safely as we restore them. Obviously things are very uncertain in terms of COVID and no doubt will continue to change, but I think what has been my experience is that actually in terms of COVID it's been a real push for people to come together and want to sort things out and work quickly to solve problems. So I feel confident if there was a case of another peak that actually we've got really good systems set up across a whole range of organisations and a whole lot of learning from the first time that actually will make sure that we pull together again to do the best for the people we look after. And just to say that carers can also find a whole range of resources available on Sirona Care and Health's website to help and support them.